is it now? Okay. Good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. Today, our speakers are joining the briefing virtually to adhere to social distancing guidelines. And we are going to begin our briefing today with opening remarks from Managing Director Brian Abernathy. Brian, you have the floor.
Great, thanks, Mike. With the holiday season upon us, both Dr. Farley and I wanted to remind residents of proper precautions during the summer heat. Some of the guidance is what we offer each year, but obviously the restrictions created by the threat of COVID-19 make this summer unlike any other. Dr. Farley will have general heat guidance in a few minutes. I'm also pleased that we're joined today by Naja Orr, the President and CEO of the Philadelphia Corporation for Aging, who will offer guidance for seniors and talk about how PCA can help. Philadelphia traditionally has an extensive heat response system that has been nationally recognized. Examples include PCA's Heat Line, which Naja will speak about, as well as our Department of Health outreach teams and homeless outreach during code red emergencies. Our goal this summer is to maintain as many elements of that as possible, despite the COVID restrictions. As you know, we made the difficult decision back in May to keep our city pools closed this summer to safeguard against the virus. We are offering, however, as one alternative, spray grounds. 91 spray grounds and spray features were open on Monday, July 6th, operating under safety guidance. The city is also offering its Play Streets program. 100 play streets in areas most impacted 100 play streets in areas most impacted by the heat island effect will have cooling kits, which include umbrellas and tents, misting fans, super soakers, and neck cooling rags. So far, 310 Play Streets applications have been approved. This brings me to the more difficult area of summer heat, how we offer help on days when the heat is the most intense, such as when we invoke a heat health emergency. We are currently in the process of determining how we can safely open facilities such as libraries and PCA senior centers during those heat events. We are working with our partners, including PCA, on balancing the social distancing needs imposed by the pandemic against the health risks of prolonged exposure to heat. This may include some out-of-the-box options that would not be necessary during a normal summer. Because the pandemic is an evolving situation, we will be providing specific details when we are closer to a potential heat health emergency. We will, however, make sure that those in need that need to go somewhere have somewhere to go. In the meantime, it is vitally important every resident try to develop a heat plan for their family members, particularly seniors. Don't wait for the heat wave to figure out what to do. Make a plan now. I also want to remind folks who struggle financially that options are available. Data from Philly Counts shows that among people concerned about heat, utility costs are a significant reason why they are concerned. In response to the coronavirus, the state's Low-Income Home Energy Assistance Program, or LIHEAP, will be accepting applications for its Recovery Crisis Program through August 31st, or until funds are exhausted, whichever comes first. In addition, utilities have extended their moratorium on shutoffs. PECO is extending its support policies, which include suspending non-payment service disconnections, waiving new late fees, and reconnecting customers who were previously disconnected until further notice. We hope efforts like this will ensure that residents who have the option of air conditioning will make use of that during heat waves. Before I turn it over to Dr. Farley, I also wanted to note that this morning we announced details regarding its partnership with North Broad Renaissance, or NBR, to support local businesses. NBR launched the Reopened with Care campaign to help businesses on their corridor reopen safely when the stay-at-home order was lifted. The goal was not only to support businesses, but also to restore consumer confidence by letting people know that businesses are following recommended safety procedures to keep customers safe. The Department of Commerce and City Council will work with NBR to bring more commercial corridors and more businesses on board with the Reopened with Care campaign. Acting Commerce Director Sylvie Gallier-Howard is with us today and will be available for questions on this program during the Q&A portion. For now, let me turn it over to Dr. Farley for his health update and heat planning guidance.
Thanks very much. So case counts from the coronavirus infection continue to rise nationally and in Pennsylvania. And here in Philadelphia, our daily case counts are rising slowly after falling for months. So here are some numbers. Since this time yesterday, we identified 143 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 26,400 since the beginning of the epidemic. Now, some of that 143 are past cases, which we identified through a database match that we did yesterday. But if you look at our graph overall on our website, you'll see that in the past week, we're averaging about 110 cases per day. Now, we have seen some shifts with this increasing number of cases in the epidemic towards younger people. In the past 2 weeks, about a third of the newly identified cases are under the age of 30. And we continue to get reports of people with infection who have traveled before they got infected to the New Jersey shore. Since this time yesterday, we identified 5 additional deaths from the coronavirus infection in Philadelphia residents, bringing us to a total of 1,614 since the beginning of the epidemic. Of that, 830 or 51% are in nursing home residents. So that's what's happening here in Philadelphia. Now, in other areas, we're seeing very rapid growth of the epidemic. U.S. case counts overall are more than 80% higher now than they were 14 days ago, and they're at all-time highs in this epidemic. The states that are particularly hit hard are the states in the South and the West that reopened without enforcing safety precautions like masks. We're also seeing rapid growth of the epidemic in Southwest Pennsylvania, around Pittsburgh. And every region of Pennsylvania now is showing increases in case counts. I want to just summarize a little bit what our response is to the second wave that we talked about in previous sessions. First, we're reminding businesses and managers of activities that they are required to enforce our safety precautions, particularly around distancing and masks, with others as well. And this week, staff and volunteers from the health department are going to stores and distributing that guidance in person, as well as distributing posters the stores can put up to remind people of the rules that they need to follow when they're in the store. Next week, we'll be launching a media campaign directed at all Philadelphia residents, talking about the importance of using masks. We really want to reinforce that simple message as much as possible. Tied to that, the mayor signed an executive order requiring people to wear masks whenever they're indoors in public places or outdoors and can't maintain a distance of more than 6 feet from other people. The governor, as you probably know now, has passed signed a statewide order saying something very similar. So mask use is now required in Philadelphia. It's required in the state of Pennsylvania. We announced on Tuesday that we were going to put a pause on restarting indoor dining at restaurants and indoor gyms and fitness centers because we were particularly concerned about the risks in those settings. We're reminding everybody who can continue to work remotely, continue to do so. If you can work remotely, that reduces the risk, so continue to do so. And we are recommending that people who are medically vulnerable, such as the people who are elderly or have chronic medical conditions, take extra precautions. The basic rules are stay home and don't let COVID into your house. That means having your other household members stay home as much as possible. And when you are around them, wear a mask yourself and have your household members wear a mask as well. Now, the second wave has got to be disheartening. After so much progress we've made, it has got to be frustrating to see case rates rise here as well as around the rest of the country. It is clear that we will be living with this virus for a long time. But the situation isn't forever. There is some hope. So I thought I'd talk just a few minutes about the long-term hope for this epidemic. And that is, to me, vaccine development. Overall, progress in developing vaccines has been extremely rapid, much faster than I would have ever expected. There are now dozens of research groups that have created vaccines that have produced antibodies when administered to animals. And those antibodies appear to protect those animals from the infection. So it really appears to be that it's easy to train the immune system to recognize and kill this virus. Much easier than with other viruses, much easier than I would have expected. But to put it in plain language, COVID-19 is nasty, but it looks like it's not very smart. Now, the New York Times has an excellent webpage summarizing vaccine development. They list 145 vaccines in development, 19 of which are in human trials. That is to say, they're giving them to humans to test out their safety and their effectiveness. There's been more than 1,000 people who've been vaccinated in just one trial alone. there are 3 vaccines that are particularly promising that are being supported by the federal, what's called the Operation Warp Speed. These vaccines use different technologies, different approaches, but they also look quite promising as far as their production of antibodies and an immune response in experimental animals. Now, the farthest along, developed by the Oxford Group in the United Kingdom, is now testing this vaccine in more than 10,000 people in the United Kingdom, in Brazil, and in South Africa. They're trying to find out how effective the vaccine is at preventing infection in people or preventing severe disease in people. And they're testing the safety of the vaccine. Once we have a vaccine that is proven to be effective and safe, then any of these companies are going to need to produce hundreds of millions of doses. That's going to take a certain amount of time. Nonetheless, I'm optimistic that we will have at least one and maybe more than one vaccine that we're deploying here in Philadelphia sometime in 2021. I can't say whether that's going to be early 2021 or late 2021. Sometime next year, I think we are going to be deploying a vaccine. I'm very excited about that. After we do that, and we feel like we're protected from this virus, and we can take off our masks and we can get together again. So we may have some tough months ahead, but there will be an end to this epidemic overall. If you want more information about where we are with the epidemic now, what our guidance is, just go to our website, www.phila.gov/COVID. Now, before I sign off, let me just talk a little bit about heat, as Brian Abernathy mentioned. I want to just point out more people die from heat as a risk than from all other natural disasters combined. More people die from heat waves than hurricanes or earthquakes or tornadoes or floods. We may not recognize it, but heat can be quite dangerous. Not necessarily dangerous for everyone, but it is dangerous particularly for vulnerable people. That includes elderly people, includes people with chronic medical conditions, includes people who have psychiatric or developmental disabilities, especially if they're low income and don't have a lot of resources, or if they live alone. In fact, it's really many of the same people who are vulnerable to the risk from COVID. And there is a risk, therefore, of having those people together in any one setting, of them potentially acquiring or spreading the virus amongst themselves. Fortunately, prevention of death from heat is really not that difficult. The basic idea is pretty simple. Have somebody be in a cooler environment, have them drink plenty of fluids. So as much as possible, we want to help people who are vulnerable stay at home safely. So that's why I want to encourage everyone in the city of Philadelphia to be prepared to check on your vulnerable relatives, check on your vulnerable friends, your neighbors, even that elderly person who lives maybe next door, down the street, who you may not know well, but you're concerned about him or her. It's particularly concerning if they live alone, they have elderly, have chronic medical conditions. The way you can help is to help them get air conditioning using some of the resources that Brian just mentioned. And if they can't get air conditioning, then simply opening the windows, using fans, and drinking fluids can help people not get their temperatures get to the dangerous levels. We don't have a heat wave that's going to happen right now, but it's not too early for people to think about how they're going to do that when we do have a heat wave. It's very likely that sometime this summer we're going to need to do that. Thanks very much. Now I'll turn it over to Armando.
No, actually, thank you, Dr. Farley, because we have a special guest today. Before we go to Armando, I'd like to introduce Naja Orr, who is president and CEO of the Philadelphia Corporation for Aging, who's going to be able to talk about some of the heat issues and heat guidance related to seniors. Naja?
My apologies.
No problem, Dr. Farley. Good afternoon, and thank you. While many of us are still staying home during the pandemic, it's important for us to remind people how the summer heat can affect those that are most vulnerable, including older adults and people with pre-existing conditions. The Philadelphia Corporation for Aging estimates about 36% of all people aged 60 and over live alone in the city. So we're encouraging everyone, as Dr. Farley mentioned, to check up on people you know who may be at risk for either social isolation or vulnerable for the heat during the summer months. If the city does declare an official heat health emergency, ECA's heat line will be activated. The heat line call center is operated by a team of trained staff who are available to counsel callers about what precautions to take against the heat and detecting signs of heat stress. Calls to the heat line can also be made on behalf of another person, or if there is heat-related concerns about someone in the community. When activated, the heat line is open to all Philadelphia residents and can be accessed by dialing 215-765-9040. The heat line typically runs from about 8 a.m. to about midnight each day but the official start and end times are dictated by the heat declaration. Although our staff continued to work remote during the pandemic, PCA is fully able to operate this year's heat line remotely if needed. Calls during the state red and yellow phases, PCA followed state guidelines, putting consumers and staff safety first, and conducted many of our essential functions remote and by phone. Also, while closed for programming, our senior community centers have also been conducting regular wellness calls to new and existing members, and the congregate meal program has transitioned to grab-and-go meals. We're now reviewing and adjusting our guidelines to ensure that we continue to put safety first, assess the status of our necessary PPEs, and identify next steps for us to operate effectively and efficiently in the green phase. We continue to take the guidance from Mayor Kenney, Governor Wolf, the Department of Health, and the Department of Aging. As it pertains to tips to stay cool, we recommend a lot of the things that Dr. Farley recommended. We typically suggest avoid direct sunlight, stay in air conditioning buildings when able, and stay hydrated by drinking plenty of water throughout the day, not just when you're thirsty. We also encourage older adults to seek medical attention if you're experiencing symptoms such as fatigue or dizziness, nausea or vomiting, or confusion. We do know that there are utility assistance available to help through the summer heat. Those include stuff like LIHEAP, which was mentioned a little earlier. There's assistance through PICO, and you could find links available through the city's website at phila.gov. So we ask that everyone stay connected to older adults, whether they're your loved ones, your friends, or your neighbors. If you can't connect through social distancing in person, then phone, social media, or video calls are the next best thing. And once again, if you have questions about the heat or any issues as it relates to supports to older adults, please contact the Philadelphia Corporation for Aging at 215-765-9040. Thank you.
Thank you, Naja. And Naja will be sticking around for the question and answer portion. For now, though, let's go to Armando for the Spanish language translation of all the remarks.
Actualización del director general Brian Abernathy para hoy, el jueves 2 de julio del 2020. Buenas tardes. El sistema de respuestas de Filadelfia al calor extremo en el verano ha sido reconocido a nivel nacional. Nuestro objetivo este verano es mantener tantos servicios como sea posible a pesar de las restricciones que nos impone el COVID-19. En mayo, tomamos la difícil decisión de mantener cerradas las piscinas de la ciudad este verano para protegernos contra el virus. Y estamos ofreciendo como alternativa áreas con chorros de agua o spray grounds. Este lunes 6 de julio se abrirán 91 áreas con chorros de agua que estarán operando bajo estrictas normas de seguridad. Igualmente, hay 100 ubicaciones del programa Play Streets en las áreas más afectadas por el efecto de la isla del calor que tendrán kits de enfriamiento y entre otros insumos. Hasta el momento, hay 310 solicitudes para el programa Play Streets que han sido aprobadas. Y estamos en el proceso de determinar cómo podemos reabrir algunos lugares de manera segura, como bibliotecas y los centros de adultos mayores de PCA durante los momentos del calor extremo. Debido a que la pandemia es una situación cambiante, daremos detalles específicos cuando tengamos una posible emergencia de salud por el calor extremo. Sin embargo, nos aseguraremos de que aquellos que tengan un lugar a donde ir, tengan a dónde acudir si lo necesitan. Mientras tanto, es de vital importancia que cada residente realice un plan para proteger a los miembros de su familia, especialmente a las personas mayores. Por favor, no espere a que la ola de calor llegue para ver qué hacer entonces. Tenga su plan listo desde ahora. También quiero recordarles a las personas que tienen dificultades financieras que hay opciones disponibles para ayudarles. Los datos de Philly Counts muestran que los costos de los servicios públicos están preocupando a muchas personas este verano. En respuesta al coronavirus, el Programa de Asistencia de Energía para Hogares de Bajos Recursos, LIHAP, del Estado, aceptará solicitudes para su programa de crisis de recuperación hasta el 31 de agosto o hasta que se agoten los fondos, lo que ocurra primero. Además, las empresas de servicios públicos han extendido su moratoria en la suspensión de los servicios. PICO está ampliando sus políticas de apoyo a la comunidad, que incluye la suspensión en el corte de servicios, la exención de nuevas tarifas por retraso en el pago y por la reconexión de servicio para clientes cuyo suministro había sido desconectado, y todo esto hasta nuevo aviso. Esperamos que esto ayude a los residentes que tienen aire acondicionado en sus casas y que estén preocupados por las facturas de los servicios durante estas olas de calor. Entre otros anuncios, quisiera señalar que esta mañana anunciamos detalles sobre nuestra asociación con North Broad Renaissance, o NBR, para apoyar a las empresas locales. NBR lanzó la campaña Reapertura con Cautela para ayudar a las empresas en su corredor comercial a reabrir de manera segura cuando se levantó la orden de permanencia en casa. El objetivo, además de apoyar a las empresas, es también el de restaurar la confianza del consumidor, informándole al público que estas empresas están siguiendo los procedimientos de seguridad recomendados para así mantener seguros a sus clientes. El Departamento de Comercio y el Ayuntamiento trabajarán con NBR para incluir más corredores comerciales en la campaña de reapertura con cautela. La directora interina de Comercio, Sylvie Gallier Howard, está con nosotros hoy y responderá a sus preguntas durante la ronda de preguntas y respuestas. Y esta es la actualización en materia de salud para el día jueves 2 de julio del año 2020. Los casos continúan aumentando a nivel nacional y también en Pensilvania. En Filadelfia, los casos continúan incrementándose lentamente. Se han reportado 143 nuevos casos, con un total de 26.400 casos acumulados. Se identificó que algunos casos pasados pertenecían a Filadelfia en nuestro cruce de datos con la base de datos estatales. En promedio, hemos tenido 110 casos diarios durante esta semana. Un tercio de los casos reportados durante las últimas 2 semanas han sido en personas menores de 30 años. Muchos de los nuevos casos reportados han tenido que ver con contagios contraídos en la costa de New Jersey. Lamentablemente, hoy reportamos 5 fallecimientos el día de hoy. El total acumulado de muertes por el COVID-19 es de 1.614. 830 de estas muertes, o el 51% de ellas, ha sido en hogares de ancianos. En todos lados, las señales demuestran que la epidemia está empeorando. En los Estados Unidos, el conteo de los casos ha subido en más del 80% desde los últimos 14 días, particularmente en los estados del sur y el oeste del país. Muchos de estos estados reiniciaron sus operaciones sin reforzar medidas de seguridad, como por ejemplo el uso de las máscaras, y lamentablemente el número de casos va aumentando en las regiones al sureste de Pensilvania. Como lo discutimos el viernes pasado, esta es nuestra respuesta ante esta contingencia. Recordarles insistentemente a los negocios, sus gerentes y supervisores, que deben hacer cumplir el uso de la máscara o cubierta facial en sus establecimientos, desplegar una campaña informativa sobre el uso de las máscaras, emitir una orden municipal que norma el uso obligatorio de máscaras en espacios abiertos y espacios bajo techo, suspender el reinicio de servicio completo de restaurantes en los interiores y también el funcionamiento de los gimnasios. Les recomendamos a todas las personas que puedan trabajar remotamente que continúen haciéndolo. Les recomendamos a las personas vulnerables, a los mayores de 65 años de edad o a los que tengan deficiencias en su sistema inmunitario a tomar precauciones adicionales. No deje que el COVID entre en su casa. Por favor, permanezca en casa. No salga a la calle para hacer diligencias que no sean esenciales. Los familiares que vivan con estas personas deben estar en casa el mayor tiempo posible. Use una máscara e insista que sus familiares y quienes cuidan de usted usen máscaras cuando no puedan mantener la distancia social en su hogar. Estaremos viviendo con este virus por un largo tiempo, pero no será para siempre. Eso es lo que esperamos. Con respecto al desarrollo de una vacuna, en general, el avance va extremadamente rápido. De acuerdo al New York Times, hay 145 prototipos de vacunas que están en proceso de desarrollo. 19 de estas vacunas han sido ya probadas en humanos y más de 1,000 personas han sido vacunadas. 3 de estas vacunas son particularmente prometedoras. Los laboratorios Oxford están haciendo pruebas en 10.000 personas en el Reino Unido, Brasil y Sudáfrica. Están midiendo su eficacia en la prevención de la infección y su seguridad. Al encontrar una vacuna efectiva y segura, deben producirse más de 100 millones de dosis. Esto conlleva tiempo y, siendo optimistas, podemos contemplar que va a tomar hasta el año 2021. Después de contar con la vacuna, podremos quitarnos las máscaras y volver a estar juntos nuevamente. Vamos a tener unos meses duros por delante, pero también habrá un final. Solo trabajando juntos podemos sobrevivir esta crisis. Y ahora quisiera compartir algunas consideraciones sobre la salud y las temperaturas extremas este verano. Hay más personas que mueren a causa de las olas de calor que de todos los demás desastres naturales combinados. Las poblaciones vulnerables son los ancianos, las personas con afecciones crónicas, que tengan discapacidad psiquiátrica o del desarrollo, y especialmente aquellos con ingresos limitados o quienes viven solos. La ciudad ofrecerá centros de enfriamiento, pero esta población vulnerable es la misma que se encuentra en riesgo contra el COVID-19. Por favor, en la medida de lo posible, ayude a estas personas que deben quedarse en casa. Esté en contacto con sus parientes, sus vecinos y amigos que estén en el grupo de población vulnerable. Ayúdeles si está en posibilidades o si tiene usted aire acondicionado. Recuérdeles que pueden solicitar ayuda en el programa de asistencia de energía para hogares de bajos ingresos, LIHAP, que tiene el Estado. Asimismo, recuerde que al abrir ventanas, usar ventiladores y tomar líquidos puede ayudarles. En los centros de enfriamiento tendremos monitoreo y balancearemos los riesgos asociados con la epidemia y con la emergencia por el calor. Y ahora vamos a compartir un plan de la corporación para los adultos mayores de Filadelfia, Philadelphia Corporation for the Aging, en caso de una emergencia extrema por el calor este verano. Si bien muchas personas permanecen en casa durante la pandemia del COVID-19, debemos también permanecer atentos sobre cómo el calor del verano puede afectar a los más vulnerables, en especial a los adultos mayores y a las personas con condiciones de salud preexistentes. Se estima que el 36% de las personas mayores de 60 años viven solas en Filadelfia, por lo que le pedimos a nuestros residentes estar pendientes de sus vecinos o conocidos que puedan estar a riesgo durante los meses del verano. En cuanto a las operaciones del PCA, podemos mencionar las siguientes medidas. Si se declara una emergencia de salud por el calor, la línea de ayuda Heatline será activada. Al activarse, la línea de ayuda estará abierta para todos los residentes de Filadelfia. El número de teléfono es el 215-765-9040. 215-765-9040. La línea de ayuda generalmente funciona de 8:30 de la mañana a la medianoche diariamente, pero una declaración de emergencia regulará las horas oficiales de inicio y conclusión de servicios. Aunque el personal de PCA continúa trabajando en forma remota durante la pandemia, la línea puede ser operada remotamente sin afectar el servicio. A pesar de estar suspendida la programación regular que tiene PCA, los centros comunitarios para adultos mayores han estado realizando llamadas a los miembros de la organización y el programa de comidas para adultos mayores se está desarrollando bajo la modalidad de recogida de los alimentos. Quisiera compartir algunas recomendaciones para mantenerse fresco este verano. Evite la luz solar directa. Trate de mantenerse en la medida de lo posible dentro de edificios o habitaciones con aire acondicionado. Manténgase hidratado tomando mucha agua. Por favor, no espere a que tenga sed. A los adultos mayores que tengan síntomas de fatiga o mareo, náusea o vómito, les recomendamos buscar atención médica inmediatamente. Y nuevamente, por favor, manténganse en contacto con los adultos mayores de su familia y si no puede hacerlo por motivos de distancia social, hágalo por video, redes sociales o por teléfono. Muchas gracias.
Okay, thank you, Armando. We're now going to move to the Q&A portion for members of the media. A reminder that Philadelphia Corporation for Aging President Naja Orr has stayed on in case you have questions specific to seniors amid the pandemic and the possibility of heat waves. And as Brian mentioned earlier, Acting Commerce Director Sylvie Gaillard-Howard is with us today and is available for any questions you may have on the Reopen with Care campaign. Please limit your questions to those topics and anything related to the COVID pandemic. If time permits, we will open the floor later to a second round on other topics. So if your hand is raised right now for another topic, please lower it and we'll try to get to you later. Remember, we have limited time. Only one representative for each media outlet is permitted to ask questions, and reporters are asked to limit their questions to 3 or fewer. Let's start off now with Jeff Cole of Fox 29.
Yeah, hi there for Dr. Farley. Dr. Farley, you've used the term second wave today based on what we're now seeing. The initial talk was maybe a second wave would come in the fall, but obviously a second wave has come in early July as soon as the region began to creep forward. Is this an indication now that there will be a second wave, a third wave, a fourth wave, and multiple waves until we've got some ability to vaccinate against this?
You know, there were people who were saying the virus is going to go away and we would see a second wave in the fall. But I always caution against that. I think that this is a new virus. There's a lot we don't know about it. There's a lot that's very difficult to predict. I think we can say, though, that we are going to be living with this virus until we have a vaccine. And that's going to be certainly months. And so we're going to have to figure out how to deal with it, try to have to keep our economy going while still having some level of safety so that the virus doesn't get to the levels where it kills an awful lot of people. And that's what we're trying to achieve now.
You talked about that you are feeling great about a vaccine, and the Oxford group there in London that's had early success. Dr. Farley, how will a vaccine be distributed to poor people around the world? And in particularly, how would you imagine it will be distributed to many of the cities like Philadelphia that happen to be the poorest in the country? How will they get vaccines early on when there'll be such a demand for them?
Well, I can't speak to the rest of the world. I can just say in the United States context that we had this experience when we had the epidemic of H1N1 influenza back in 2009, if I'm not mistaken. Initially, we had small amounts of vaccine, and so we made it available to the people at highest risk. That vaccine distribution was organized through the federal government, and then we distributed the vaccine to healthcare providers who could give it to people who were elderly or had chronic medical conditions or at high risk. So I would imagine it's going to be something like that here.
And one more question for Brian. Brian, about the I want to make sure I got this right. The shutoffs. There's a moratorium now on any energy shutoffs to homes across the city?
Yes, sir.
And did you ask PECO to do that, or did PECO volunteer to do it? And have they done it before in the summer season?
I don't know if I can answer if they've done it before. We've been in consistent communication with PECO, PGW, certainly our water department, and around COVID, and certainly given the financial hardships that our residents are facing, I think all of our utilities have voluntarily agreed to delay those shutoffs. Yep.
All right, thank you, Jeff. And let's go now to Yaima Crespo of Telemundo.
Buenos días, buenas tardes, mejor dicho. Tengo dos preguntas para Brian. La primera es, ¿por qué las autoridades no pueden reforzar con multas el uso de máscaras si el gobierno las está pidiendo?
My first question, I have two questions. It's for Brian. Why can't the city enforce the use of masks through fines if other communities are doing so?
You know, we said early on that enforcing with fines we thought would have a disparate impact, and we don't think it's practical to have our police officers try to enforce wearing masks, especially given the current climate that we're working in. And we believe that continued social pressure is a better option around masking. Dr. Farley, I don't know if you want to add anything.
Yeah, I think that's very important. What we've learned in the past in public health is that if you make something mandatory, even if you don't enforce it, a lot of people take it more seriously and are more likely to follow that. And so we'll see. We're tracking mask use in Philadelphia, but I'm optimistic that just having the order itself out there and publicity around it will make a big difference in mask use.
La respuesta es que, como dijimos tempranamente, al principio nosotros no pensamos que hacer el cumplimiento de esto a través de multas sea algo que funcione porque va a haber un impacto desigual para ciertos residentes. No es una buena práctica el hacer que la policía esté encargada de hacer cumplir con esta normativa, especialmente dado el clima que tenemos actualmente. Y nosotros creemos que la presión social debe ser continua y va a ser más eficaz y es algo mejor. Y agrega el Dr. Farley de que es importante lo que hemos aprendido en el curso de nuestra experiencia con la salud pública, que es dar una orden de obligación, se tiene que hacer con un seguimiento para ver cuánto uso se está haciendo de esta orden. Pensamos que ese es el mejor camino. ¿Cuál es la siguiente pregunta?
La siguiente pregunta es, de hecho, estamos escuchando de propietarios de negocios que dicen que están teniendo que contratar a sus propios guardias de seguridad para reforzar o hacer cumplir con esa medida. Y dicen que, bueno, que ellos mismos se sienten que tienen que hacer enforzar esas leyes o esta regla y que de no hacerlas cumplir, pues ellos mismos, estos propietarios, serán multados o perjudicados.
La pregunta es si ellos van a ser multados o perjudicados, ¿verdad?
Sí.
We're hearing from business owners that they have had to hire their own security personnel in order to enforce the measures that have been issued, and that they themselves are having a hard time having their clientele comply with wearing masks and all the other orders. Will there be any fines for business owners if they're not able to control their clientele?
No, we're not fining our business owners, and we certainly are encouraging our business owners to do their best to enforce the masking rules. But we don't want them to get into arguments or into conflict with their customers. We've seen incidents where that has ended badly, and we certainly don't want any of our businesses or their employees to put themselves at risk. But again, as Dr. Farley said, I think we're optimistic and hopeful that we'll see this masking requirement take hold, because we realize that in order to keep us all safe, we all depend upon each other.
No estamos contemplando que se impongan multas a los propietarios de negocios por hacer cumplir con las normas que hemos emitido, y les alentamos y les recomendamos no involucrarse en conflictos ni peleas con sus clientes. Nosotros estamos viendo estos incidentes y sabemos que ha habido una reacción mala por ciertas partes de personas que no quieren observarlas, pero les pedimos a los propietarios y a sus empleados de que no se arriesguen y no se enfrenten con ello. Nosotros permanecemos optimistas y tenemos la esperanza de que el uso de las mascarillas se extienda y se cumpla.
And Armando, if I could add, there is a difference between businesses who are attempting to enforce the masking requirement and those who are just flaunting it. And so those businesses who are just ignoring our requirements, they're likely to be fined in one form or another. But there's a difference between those who are trying and have struggled and those who just don't care.
Brian quiere acotar algo que es bastante importante, que hay una diferencia entre aquellos negocios que están intentando hacer cumplir las órdenes y aquellos que están deliberadamente incumpliéndolas o alentando a sus clientes a no hacerlo. Y para esos negocios pudiera haber multas más adelante, pero nosotros hacemos esa distinción entre aquellos que están tratando de hacer cumplir con lo correcto y aquellos que no lo están haciendo. Gracias.
Gracias.
Thank you.
All right. Thank you, Yaiman. Now let's go to Laura McChrystal. Hold on one second, Laura. Let's go to Laura McChrystal of the Philadelphia Inquirer.
Hi, everyone. I have a few questions for Dr. Farley. First, the Inquirer ran a chart today. I'm not sure if you saw, but it showed that basically from June to July, deaths increased at a faster rate than new cases of the virus. I'm wondering if that was something you had tracked or that you can provide a reaction to.
I did not see that particular graph. I will say that the deaths tend to lag behind the epidemic of deaths, tends to lag behind the epidemic of cases. People acquire the infection, they're sick for a while, and may die later. And so there may have been a period of time there where cases were falling, but deaths were still rising. I'd have to look at the graphic to see. In general, though, the number of deaths has been falling. We've had a few days in the past week or so where We had 0 deaths. I think we had 3 days in a row with 0 deaths to report. We had 5 today. That's much less than we were at the peak of this epidemic when we were at 35 deaths per day. So we're not past this, but clearly we've made a lot of progress in deaths, but they're not necessarily in sync with cases.
Okay. I'm also curious if you could tell us which metrics, if any, are you watching most carefully? Like if cases started to rise at a faster rate, or I guess if we were just headed toward trouble, like where would you spot it first?
You know, it's hard to predict which of the different measures we're looking at might show us news the best and the earliest. But we are certainly tracking the number of cases we have per day. We're tracking the percent of tests that are positive each day. We're also tracking the early warning signs we put in our plan. That's the number of people who come into emergency departments with symptoms compatible with the COVID infection. And we're tracking the number of people, the percent of temperature tests that show a fever through the internet-based thermometers. Those are probably the 4 things that give us a sense of the activity of the virus in the community. Then we have other measures of the special settings like nursing homes and our activities themselves.
Okay. And lastly, as we head into July 4th weekend, I'm wondering if you could comment on how you plan to spend the weekend. You know, would you attend a barbecue?
Absolutely not. I'm trying to be safe, and I follow our own recommendations. So I'm not going to be around other people other than my family.
Okay, thank you.
Thank you, Laura. And I just wanted to note that we are somewhat short on time today. We have a big number of speakers. If possible, please limit your number of questions to 2, if possible. We would appreciate that. Let's go now to Natasha Brown of CBS 3.
Hi, everyone. This first question is for Dr. Farley. Dr. Farley, we know that gyms are not going to be included yet in the green phase for the city, but many Philadelphia gym owners want to know why their businesses aren't being included in this when shopping malls and casinos are allowed with social distancing guidelines. Gym owners are asking why they're not allowed to open responsibly as well.
Yeah, I understand that a number of gym owners are not happy with this, and I'm sympathetic to them. This has got to be a tough time for them. The reason is that the gyms are different is that when people go to gyms, they're involved in vigorous physical activity. And there is evidence that when people are engaged in vigorous physical activity, they're breathing more, they're maybe more likely to put out droplets, more likely to take in droplets and get infected. And also people involved in vigorous physical activity are uncomfortable wearing masks, so they may not want to wear masks. And so it makes it a risky situation. And given where this epidemic is going nationally, we want to be just very cautious right now.
Okay, and last question for Brian today. We know that you said 91 spray grounds are going to be set up or around the city and 100 play streets. Can you kind of describe what that will look like? Play streets? Are you saying play streets? I'm just trying to get clarification.
Sure. So we've run a Play Street program for a number of years, and that Play Street program is based on volunteers in a block that set up activities for kids. We provide meals for those kids and activities. And so those 100 Play Streets, so we have over 300 Play Streets. 100 of them are going to be outfitted with some cooling packs that include super soakers, spray fans, things like that, especially in those areas that have the biggest impact from our heat island effect throughout our communities. So it's a great program and one that we really depend upon the community for, and those volunteers are absolutely amazing.
Okay, thank you very much.
Yep.
Thank you, Natasha. Let's go to Queen Muse of Philadelphia Magazine. Queen, you're up.
Hi, yes. So one of my questions is just about resources being provided to folks with regard to staying cool. We know we're not going to have city pools. We do have these sprinkler parks, but when you say something like, check on the elderly, say you check on them and they do not have access to fans or air conditioners or other cooling agents. Is the city considering doing anything where they would provide those types of resources for folks who are, high risk and don't have the resources for those things?
Sure. So we're going to continue to work with our not-for-profits and our business community to continue to distribute fans and other supplies to protect those vulnerable populations. It's not something that the city is going to be able to do on its own, but we have great partners like PCA and PICO that are going to continue to help and provide some supports.
And Naja, did you want to also?
Yes, I'll jump in there. I would say anybody who has concerns about older adults, definitely don't hesitate to contact our office. We're really looking at both aspects of which we anticipate occurring in the summer, whether it's COVID related or heat related. So we would ask people just to contact our office so we can see what resources are available to them that we can connect them to.
And a second question, and I know we don't have anyone directly from sustainability on the line, but just curious about the status of the Greenworks program in terms of installing trees. I know COVID has kind of hampered down lots of progress with programs like these. Do we have any kind of status update on whether or not COVID has affected the efforts to plant trees and continue toward the goal of the Greenworks program? If so, are there any measures being put in place to keep things on track in that area?
Sure. So on the tree program specifically, I'm not aware of any expected delays. We certainly continue to distribute trees this spring, actually. With some modified guidelines, but that distribution still continued. We can certainly double check with sustainability to see if there have been any slight delays, but I don't expect I wouldn't expect significant delays. Certainly everything's been impacted, so I'm not going to say there's none, but I wouldn't expect major delays.
Okay. Queen, are you good? Let's go now to Catalina Jaramillo of WHYY.
Hi, thank you, Mike. So my understanding is that this is guidance. So my question is when is the city presenting a heat emergency plan, given that, as Dr. Farley said, heat kills more people than natural disasters, and also it kind of affects the same vulnerable population than COVID?
I mean, I think this is. I mean, we do have a heat emergency plan. We've had one for years. The majority of that is still going to be in effect, and the only the big differences are going to be around when we activate and how we activate libraries and senior centers to provide cooling spots. But certainly expect cooling centers in one form or another. So I'm not sure I fully understand your question, but I mean the heat plan hasn't actually changed significantly from what we've had historically.
Right, but the heat plan says that the cooler centers are senior centers, libraries, and pools, which are all closed. So
I think in my comments, Camilla, I said that libraries and senior centers are considering how to open them safely, and that we also guaranteed that if anyone that needed somewhere to go would have somewhere to go. And actually that those cooling centers are one small piece of a much larger and comprehensive plan.
So, and maybe this goes to that same thing, when you say when somebody needs something to go, they'll have something to go. How are you communicating all this? Because as the city's heat pilot survey and Hunting Point found last year, one of the biggest issues was communications of all these services provided. A lot of people didn't know that there were any cooling centers or anything that they could help. I spoke with a lot of people this morning that didn't have ACs, and what they do for the heat is close all their windows. So there is not a lot of information for what to do. How are you planning to improve that communication?
And Catalina, I think that's a fair point. Communication is and will always be a struggle. We have actually engaged our Philly Counts folks to help us with that communication and provide guidance and understanding exactly what residents should do. And I think we are going to have to take some consideration for what's happening with the virus at the time of the heat wave as well, right? If we have a huge spike in the virus, we may not be able to open a library, but we may be able to do something else, whether that's bringing a SEPTA bus or multiple SEPTA buses. I think all of those things are on the table. And we're going to have to figure out a strong communication strategy in order to make sure people know where to go and how to access those resources.
So it seems like you're going to react to when that happens more than have a plan.
So we have a plan So any plan, any emergency management plan, we can't predict exactly what's going to happen in the future. I can't tell you if COVID-19 is going to continue on a plateau or we're going to have a huge spike in August. I don't know that. And so we plan for contingencies. And so we have a plan, and we also have plan B, plan C, and plan D if we have to react to that, because that's what emergency management does. So, I don't think it's fair for you or anyone else to say we don't have a plan. We absolutely have a plan. We tried to provide broad brush strokes of that plan today. And I'm confident that we're going to be able to rise to any heat emergency that we face.
All right. Thank you, Catalina. We're going to go now to Martin Pratt of Philly YBN.
Thank you. Dr. Farley, when you mentioned about the study in London and we talked about vaccines, can you talk a little bit for my audience about realistically what's the success rate and the failure rates of vaccines? We know that there's, when there's a vaccine, it doesn't save everybody's life, unfortunately. So can you talk about that?
Well, different vaccines, some are more successful than others. We have, measles vaccine that is very, very effective. On the other hand, influenza vaccine will vary from year to year, and maybe it will prevent infections in 50% of people or 70% of people. Even influenza vaccine, if it's not totally effective, it may prevent severe infections. So people may get ill, but they may not die from it. And so it still has a lot of value. I can't say the first vaccine that is deployed, how successful it's going to be, whether one shot will protect everybody 100%, or whether one shot will protect people 50%, reduce infections and reduce severe infections by 50%. Probably be somewhere in that range. Either way, though, could save many, many, many lives. And so I'm still very optimistic about where we're going. And I would again say that every study I've seen so far, the vaccines under development, makes me more encouraged about how this is going.
Thank you. Brian, can you talk about the Play Streets programming for, you said 100 of the streets, of the 300 streets, will have access to the cold packs and the super soakers, which is great. How can the audience find exactly what Play Streets those hundreds are and where they're located at?
Sure. So we have all that information online. We can certainly get it back to you, Martin.
Okay. And real quick, Brian, one last question. Greenworks, there was a plan. I went to a meeting in, I believe, February at the University of Science, and they talked about a plan for growing vegetables on the streets of Philadelphia. Is that still works, or has that been on the shelf?
I'm going to have to get back to you. Without our ability to meet in person, some of that stuff has been delayed. So we'll circle back.
Thank you.
All right. Thank you, Martin. Let's go to Kennedy Rose of the Philadelphia Business.
Hi, everybody. I just have one question that could be for Brian or Dr. Farley. I was just wondering, what have you seen in terms of compliance with business guidance, and are businesses largely following city guidance?
I don't have any numbers for you. My, anecdotal sense walking around is that most are following the rules, but I don't have any numbers for that.
Okay, that's all I had. Thanks so much.
I was muted. Let's go to Layla Jones.
Hi, my question is Dr. Farley. I'm wondering how and where is the city tracking messages?
Looking at people who are stations, and then we're looking at people who are exiting stores, and that's scattered in different parts across the city.
So there are no other details, or just what does that look like exactly?
We're looking at video footage from surveillance cameras, and people just looking at that and counting who appears on the screen and whether they're wearing a mask. And I don't have any more details than that.
La pregunta para el Dr. Farley es que hay personas a quienes les preocupa que en el aeropuerto no están tomando temperatura y cómo asegura la ciudad que estas personas guardarán la cuarentena.
The question is for Dr. Farley. There's people who are concerned that the temperature is not being taken at the airport, and what is the city doing in regards to that?
people with this infection can have fevers, but not everyone does. And so temperature taking isn't something that we are broadly recommending as a way of screening because even if you take temperatures, you will miss many people with the infection and it may give you a false sense of security. I can say that we are recommending in business and activities that they screen people for symptoms when people report whether they have symptoms and have those people not be at their work site if they have those symptoms. So I'm not sure exactly what setting you're talking about, but if there's a complaint about a particular business that is not following any of our safety guidelines, you can bring that complaint into 311 and we'll see if we can send someone to talk to that business.
Nosotros tenemos información que necesariamente no ayuda al tomar la temperatura a las personas que están en riesgo, porque no todos van a mostrar los síntomas sencillamente por la temperatura y eso va a dar una sensación de seguridad que es falsa. Si hay negocios en los cuales hay personas que tengan resultados para los síntomas, se les pide de que se reporte esto y que no vengan al trabajo. Si se sabe de que hay algún entorno en el cual no se esté cumpliendo con las observaciones para los empleadores o los negocios de controlar esto, se les pide que notifiquen al 311 para nosotros poder investigarlo.
Perfecto. Muchas gracias, Armando. La otra pregunta es para el invitado. Queríamos obtener un sonido aquí en español para aquellas personas que pudieran estar en riesgo y que dónde pueden acudir si estas altas temperaturas pues les están afectando en la ciudad.
Lo que quieres tú es que nos digan cómo pueden acudir a los servicios de PCA las personas que hablan en español, ¿verdad? Que si
perfecto, sí. Español. Sí, gracias.
The question is for our guest from PCA, and is how can Spanish-speaking persons at risk during the heat wave can access some of the services that PCA is offering?
We definitely encourage anybody to contact our office. We do have translators that work for our office, as well as individuals and companies that we work with that are able to translate many languages for us. So we typically serve individuals or our consumers that speak over 20 different languages in the city of Philadelphia. So we're definitely willing to and able to accept those calls.
Thank you, Naja.
You're welcome.
La respuesta es que nuestra oficina cuenta con personal, contamos con intérpretes para español y también las compañías con las cuales nosotros trabajamos tienen traductores disponibles en muchos idiomas. Nosotros ofrecemos servicios en más de 20 idiomas y definitivamente les alentamos a las personas en la comunidad que necesiten ayuda a acudir y contactarnos. Habrá servicio de traducción disponible.
Perfecto. Muchas gracias, Armando.
Muchas gracias, Argenis. Thank you.
Okay, thank you, Argenis. And finally today, let us go to Rudy Chinchilla of NBC 10.
Hi, everybody. So my question is for Brian. I think you mentioned that the city is trying to work with some nonprofits to distribute fans. Where and how can people avail themselves to those fans?
You know what? We're going to have to get back to you on exact details because I don't think I have an event that I can point you to right now. But I think we recognize that there are going to be resources that are needed, and that will need to be a joint partnership between nonprofits and corporations alike.
Okay. So my next question is related to that, and it's regard to cooling centers. I know you said, the city has a plan in place for a heat health emergency. I guess, and Catalina was asking about this too. The question is cooling centers, right? You mentioned spray grounds. Well, I don't think a lot of the vulnerable people, older people, are necessarily going to be chasing each other around with Nerf guns and stuff like that. So they need a place to go. I know I did ask the city about this about 3 weeks ago, and I received the same response that you gave today, that you're sort of waiting to see as we get closer to those dates of declaring the heat health emergency. I think we asked about this about 2 weeks ago and received the same response. And again, today we're receiving that same response. But on Monday, I think, is when we're going to start having a week's worth of 90-degree plus heat. So when will the city decide to release any guidance on cooling centers specifically? And has the city not looked at other cities who have opened, like I think Los Angeles has done this? They've opened cooling centers themselves, and they tried to implement. I think someone else's audio is playing. But other cities like Los Angeles who have opened cooling centers and have still been able to implement social distancing practices.
So let me be a little bit more clear, and Dr. Farley, you can interrupt me if you think I say anything incorrect or off base. Our plan is to open up the cooling centers that have always opened. So the 12 libraries, the senior centers, during a heat emergency. The reason we're saying and being, you can call it coy, or we're being cautious in what we are promising, is I don't know what the virus is going to do in 2 weeks, in 4 weeks, in 6 weeks, and neither does Los Angeles, frankly. We are trying to make sure that we have options should the virus spike. And in some of those places, we are not going to be able to open in a socially distant way. They're too small, or just not. It's not appropriate. We're going to have to think through how we manage through that. But I will say, and I will say today, our intent is to open the 12 libraries that have historically been cooling centers. I've actually asked our staff to identify additional cooling libraries that could be used as cooling centers, and the senior centers should we enter into a heat emergency. So I just don't want to. What I don't want to do is get into a position where I say these are going to be open, but we're in the middle of a virus spike and we're not able to do that because then all of you will say, well, why didn't you open? And so I'm trying to say that we have a plan A, which is to open the centers. Plan B may not be able to open the centers, but provide other resources. And then there will be a plan C and a plan D, depending on what's happening with the virus. So that was what I was trying to convey. If I didn't do that, I apologize to you. I apologize to Catalina. That is our first plan.
Okay, and so I guess
if I could just add to that, even previous times, the vast majority of people who are vulnerable don't avail themselves of cooling centers. There's a limited number of centers, and it's difficult for people to get there. And so, at the health department, we've always been trying to say, let's take advantage of the other options we have, and people, friends, and neighbors actually can reach an awful lot of people. That's especially even more important now than under ordinary times, when a cooling center may be a site where the virus could be transmitted. So that's why we're talking so much about people helping their neighbors. It's a safer way to stay cool, and we do think we can reach a lot of people that way.
I do just want to add one other thing to what Dr. Farley said is, we certainly recognize our responsibility to provide resources to our residents, and we are doing everything we can to get those resources out to our communities. But we can't do it alone. That's why I referenced corporations. That's why I referenced nonprofits like PCA, all the CDCs that are providing support. I can go on a list of people who are helping our communities and our neighbors. And we're all going to need to come together as Philadelphia to not just to continue to get through COVID, because we're not done yet. You've heard us say that for a while. And the city's not going to be able to provide everything that I would like us to be able to provide. We never have been able to because we're a poor city, but even given the current financial conditions, that's going to be even more challenging. So that partnership and that communities really coming together becomes that much more important. But again, the city is going to do everything we can to provide the resources that our residents need and protect them from extreme heat and other emergencies as we go forward.
And I'll also jump in there and piggyback off of what Brian and Dr. Farley were saying. For each heat emergency, we alter at times which centers are available and which ones we use. So just like now, we're looking at operationally, what are the center's needs right now? How are they doing with PPEs? Do they have the appropriate space for social distancing? Are we going to use that specific site more for grab and go? So we're right now operationally looking at what their needs are, which sites we do want to choose to open as cooling sites versus which ones we'll primarily have as grab and goes because they may not have the space for proper social distancing. So those are some of the things we're assessing now, but we do have a plan in place. The heat line is ready to be activated once the city makes the call, and we're ready to go.
And by the way,
Rudy, we're about out of time. Did you?
Yeah, sorry, real quick. So you said all of you guys have said check on your neighbors. Is it safe to take in say an elderly neighbor into your place, if you have air conditioning and they don't? Is that something you guys would recommend?
Depending on the circumstances, that may be far safer than having them grouped with a bunch of other people in a small space. And so, everybody understands the basics of safety here: masks, distance, hand washing. And so, under some circumstances, that may be a very safe way the safest way to approach that situation.
Excellent, thank you. And just real quick, if I could just squeeze one more non-coronavirus related question.
We might be out of time, Ruby. I'm sorry. We have Maggie Kent of 6ABC. Maggie, do you have a quick question? We are over time here. Let me unmute you. Hold on one second, Maggie.
Hi, yes, I have one quick question about mask wearing and compliance. Is there an average number or percentage that you would have citywide that you can refer to about the compliance numbers?
Yeah, so our first observation, we found that 55% of people in SEPTA stations were wearing masks, and 78% of people exiting stores are wearing masks. We would like those numbers to be higher, 80% or greater.
Okay, thank you.
Thank you, Maggie, and thank you, everyone, especially to Naja Orr, the President and CEO of the Philadelphia Corporation for Aging, as well as Acting Commerce Director Sylvie Gaillard-Howard. Our next briefing will be next Tuesday, and in the interim, please have a safe weekend.